be less saturated compared to the UK.
Okay.
Okay, so it's slightly easier to get jobs here compared to the UK, especially if you have the experience. Now,
Hello, my lovely viewers. Welcome once again to my channel, the go-to for everything lifestyle, education, and health. Today, I've got good news and I've even got better news. So I'll start with the good news. The good news is that today's episode is going to focus on updates regarding relocating to Ireland as an international medical graduate. I previously had a video with Dr. Tumike on the channel who gave us an exposition to what it takes. If you haven't watched that, I'll urge you to watch that first. And today I've got another IMG doctor who's also going to share his perspective. He's going to talk about his own journey as well, and he's going to narrow it down to updates on what it takes to relocate. Now, the better news is that he's got an exciting package. He offers services and guidance to IMGs all over the world, one-on-one guidance as to how they can successfully relocate. He has, services that have to do with helping to apply for jobs and so on. So grab your cup of tea and let's dive right in. Hi, lovely viewers. So as I said, I've got my guest speaker all the way from Ireland. He's going to talk to us about his own journey and some specific questions that some other IMGs have asked through emails, like what's the exams like, what resources are needed, what are the pathways, and so many things. It's really going to be an exciting episode, so please sit tight, get your cup of coffee, and let's dive right in. I'll allow my guest speaker to introduce himself, tell us all about him, and then we'll proceed with the rest of the segments. Hello, Eddie.
hello, hi. Hello everybody. My name is Eddie Upunayusi. I am originally from Nigeria, Edo State, Nigeria to be precise. Um, uh, Brief, introduction of myself. I graduated medical school in 2017 from Ambrose Ali University, Ekpoma, that's located in Edo State also.
Okay.
Did my national youth service, did internship in Edo State also, and then I worked for two of the largest private hospitals in Edo State before I relocated to Ireland. Now, prior to relocating to Ireland, I was just about to start my residency in anesthesia,
Oh,
and I had to
nice.
leave. So I'll tell us the whole story about how that, that came about. But
Mm,
um, so basically, my pathway or my route to Ireland is probably different from the conventional route, different
mm,
from the pathway that most people, most prospective candidates will use. This is because my wife is Irish, so she's Nigerian Irish. When we got married, I didn't want to come to Ireland, before. I had Ireland was not in my plans at all. But when
Oh,
we
I
got
see.
married, yeah, we got married and then we discovered that she was pregnant with our twins at the time. So I had to
Wow.
drop everything and come to Ireland. So it was a bit difficult because when I came, I didn't have PLAB, I didn't have press, I didn't have anything. The only thing I had was my IELTS exam, you know. So when I came to Ireland in 2021, April 7th, I had to then write PLAB 1 in 2022. I did it in Belfast because I was already in Ireland. But I came in with a stamp 4 visa. So with a stamp 4 visa, I don't need work permits. That gives me permission to work, to start business, to do everything. In fact, I enjoy all the benefits, like
Brilliant.
almost like an Irish, So I did my PLAB 1 and then I did press 3 exam in 2023. The reason for these delays was because, it was just the time that COVID-19 was coming down. So the frequency of exams was not much. In fact, the whole of 2021, 2022, there was no slot for exams. It was from 2023 that they, reopened the exams, you know.
Mm,
Yeah, so I did my press three in October of 2023, and then got my full license, my registration in February of 2024. Okay.
Mm.
However, prior to, you see, there was a there was quite significant, gap distance from when I came into Ireland till when I got my license. So while, chasing my exams and all that, raising a family, I had to do, another job. So I was working in for Amazon Web Services in a technical support role. So that was remote. That gave me enough time to, study, prepare for my exams, write them, pass the exams, and, take care of my family along the way. And then I only started practicing recently in Ireland. I, I wanted to go into anesthesia. That's my primary area of interest. But
Mm.
because I didn't have any particular experience in anesthesia, it was quite difficult to land a job. So I decided to go into internal medicine. So hematology is the other area that I also have interest. So when I applied for a role in hematology oncology, I got the role. So that's where I'm working currently as a standalone senior house officer in hematology oncology here in Ireland. So the plan is to get into the specialist training, which I've already applied for. I'll also give us, more information about that specialist training, which, we know as residency. We call it basic and higher specialist training here. Okay, so I'll give us information about that. So plans to go into that and, get into the higher specialist training and become a hematologist, hopefully.
Wow.
Yes. So, yeah, that's the brief, rundown, um, brief introduction.
Oh, thank you so much, Eddie. Viewers, I
Mm.
forgot to tell you, Eddie is someone I've not met in person, but he kindly agreed to show up on my channel and have a chat with me today. So please show appreciation in the comment section below. We rarely get guest speakers, coming on to share their life story, to share with others for free as he's doing today.
Yeah.
So Eddie, to
Yeah.
set the ball rolling for our
Mm.
IMGs. Can
Mm.
you briefly tell us about the various pathways? I know there may be multiple pathways, but can you tell us
Mm.
the more common ones?
Okay. So now there are a few pathways that you can use, but the commonest one for, de novo IMGs that want to come to Ireland directly. When I say de novo, I mean you don't have any other qualifications or registrations outside from your primary one. Okay. For Nigerians, for example, outside your MDCN registration, the
Hmm.
commonest pathway will be the press three, will be the press pathway. Okay.
Okay.
That's the press pathway, that's the pre-registration examination system. Okay. Now, there's what we call the press level one. Press level one involves you creating, an account with the Irish Medical Council. You send them your documentations for verification. You also have to send your documents to Epic ECFMG for verification
Mm,
also. That's press level one.
okay.
Press level two, what we call press two, is an MCQ exam. Okay, so it's basically like Plat 1. While press 3 is like Plat 2, is the equivalent of Plat 2. Okay, so that's where you have your, clinical aspect of the exams, okay, where you have your history, examination, your case presentations and all that. Okay. After that, you do the press level 4, which then involves you applying for your, medical registration after
Mm,
you've passed your press level 3 exam. So the press route is the commonest, okay? Though it can be quite long, okay? It can be quite long if that's the first, that's the first route that you're taking. If you don't have GMC or you don't have any other registration, that's the commonest route, and it's usually the longest. Another route you can take is if you studied in a European country, you qualified in a European country or a country in the European Economic Area. These
Mm,
include Australia, Malta, Sudan, South Africa, New Zealand, Pakistan. Okay, so these
mm,
countries are recognized by Ireland. So their medical training, is recognized by Ireland. So if you train there, you can apply to do your internship in Ireland. Okay.
wow.
So when you apply to do your internship in Ireland, you can use that route to get your
Mm,
IMC. Okay. The third route, which is not very common, but um, it's very possible, is the specialist route. So if you've finished or completed a recognized specialist training program
mhm.
where you are, you can then come, you can then apply in the specialist division. Now, the previous two I spoke about are in the general division. So you apply for the general division of registration, the general registration. Okay. Now, if you complete a specialist training program, okay, for example, fellow Royal College of Physicians or it has to be a recognized one because not every training program everywhere is recognized by Ireland. Okay. So
Oh, I see.
training programs in countries like Saudi Arabia, in
Mhm,
Europe, most of them are recognized by Ireland. But you see, most other places they are not. Okay. So most people that will be coming to Ireland with a specialist registration directly are probably those that have trained somewhere in Europe, somewhere in the Middle East, like Bahrain, Kuwait, or Oman, or
mm,
Saudi Arabia. They are recognized. Some of their postgraduate, specialist training programs are recognized. So you can apply with that, and then you can get your specialist registration, specialist division registration. Okay. Other process, trainee specialist position, you also have to be in a recognized training program for that. Okay. So these are the commonest routes. The press route, specialist um, registration route, and then the internship. Those are the commonest route, with press three being the commonest. Okay. Now, one thing to bear in mind is that the process for Ireland is a bit slower compared to UK. Okay, this is because the system is probably not as organized like, as it is in the UK. Okay, the press three exam, for example, is only written maximum 4 times in a year. Press two exam has just been reintroduced now. When I wrote my exams, press two was not required. Okay, now you can still use Lab 1 to write press 3, but now they've introduced press 2 again. Okay, so you
mm,
write press 2 to write press 3. So what we did in our time is that we had Lab 1. So with Lab 1, you can apply for press 3 exam, and then you
mhm.
write press 3 exam. Okay, so those are the commonest routes for to get the IMC.
Okay. That was
Mm.
excellent. Eddie, can I just ask? I know this is just on the side. So, do you have any special interest in education or the way you broke everything down, like
Oh
in
yeah,
points?
yeah, yeah. Yeah. I do have interest in education.
Okay.
Yeah, I usually teach medical students where I work.
Oh, brilliant.
Yeah, I also give presentations. I do simulations. Yeah, I'm very interested in education.
Excellent. I mean, I can just
Yeah,
tell from, yes,
yeah,
how you've broken things down, how you've
yeah.
simplified, the steps. And I believe viewers
Hmm.
out there are
Hmm.
going to appreciate this. If you're
Yeah,
watching, you can play, pause, and, get all the details that you need for your pathway. Now, Eddie, there's
yeah.
something that you mentioned. You talked about the process
Mm.
being a bit slow. I know this is
Mm.
quite a tricky question, but how
Mhm.
slow is slow? Maybe can you just give maybe an
Well, it
average
depends on
timeline?
yeah. So it depends on the stage you are.
Mm,
Right. For me, it
yes.
was slower because the only thing I had was my IELTS exam, which is the English, language exam. Okay. And because it was COVID period, it was slower. Okay.
Yes. Yeah.
Now, on the average, if you apply for, if you create an account with the Irish Medical Council and upload your documents for verification, that takes about 4 to 8 weeks. Okay,
Okay.
assuming you provide everything that is required. Okay, so you will get a response within 4 to 8 weeks. Most times 8 weeks. Okay. Now, when they review everything and they tell you, oh, your documents are in order, you are, you know, by this time you've already done tab one, I assume, or you've already done press two. Okay, because if you've not done press two, that's another time that you take. If you've not done tab one, that's another time. I'm talking about the press three route now. Okay.
Okay.
Now, because you have to have done those before you can create, you have to have done those so you can upload all those results and everything to be eligible for
Mm,
press three exam.
okay.
Okay. So the
Okay.
first thing you do, create an account with IMC. You have to have finished your internship. That's one. You have to have finished your internship. You uploaded your documents for verification. Okay. That will take 4 to 8 weeks. Now, if you have written lab one, you have to add that to it. If you are writing press, if you've written press two, you add that to it. And if you take 4 to 8 weeks for them to get back to you to tell you, hey, you are eligible for press three exam. Okay. Now, press three exam is usually written maximum of 4 times in a year, usually around spring and autumn. So around April, May, you have slot that period, and around August, between August, September, October, you also have slot. Now, most times they don't give enough time before the exam. What I mean is, if the exam is going to be in April, they'll probably bring out the date around February.
Well,
Yeah,
that's
they'll probably bring out the
very
dates.
little
Yeah, they'll probably
time.
bring out the
Yeah.
dates around February, too early January. Unlike Plab one or Plab two, where your exam date can be the following year, you know. So that's how it is. Now, on the average, from press two to writing press three, you can take anywhere between 18 to 24 months, depending on how fast you are. Because sometimes when you send documents for verification and they try to contact your school, they don't get any response from your school, that takes longer,
Mm,
for them to verify your documents. Okay. And then that means you might miss the slot for application for the press three exam. You then have to wait for the following slot, which will be months away. Okay. So
yeah.
yeah, so what I usually tell candidates is make sure you have all your documents ready. Okay. First things first, if you are doing your internship currently, create an account with Epic ECFMG, get your documents, your transcripts, your internship letter. If you finish your internship, the certificate to show that you finished your internship, everything getting verified with Epic. Okay.
Mm,
Epic will send copies of this to the IMC.
okay.
Okay. And then you create an account with IMC, upload the required document. There are some required documents. I can give you a list of this later on. Create an account, send these documents to IMC, let them verify the document and have that, okay,
Mm,
including
mm,
the English language testing exams like IELTS or OET exams, okay? And then, you know, wait for their response, okay? Now, prior to doing all this, when you go to the Irish Medical Council website, there's a portal where you can do an eligibility test. That
okay.
means that you can answer some questions and they give you
Mm,
the route that is best for you that you can
oh,
use. Okay, because when you are
that's
creating,
helpful.
yeah, when you are creating an IMC account in their portal, you have to state the route that you're going to use to get the IMC. Okay.
Mm,
Yeah, because the fees vary for each route. So if you put in a specialist route, you're going to get a different fee from the press route, from the internship route. So you have to be very clear and specific in the route that you are taking when you are, creating an account at IMC. So when you go to the medical council website, you can take the eligibility test there, and it will automatically tell you your route is press 3. Okay. Yes. So on the average, cumulatively, depending on how fast, it can vary from 18 to 24 months. Some can be 12 months. That's for people who already have their PLAB one. If you already have your PLAB one, it can be very fast for you. You just need to apply. If you already have your EPIC verification done, you already have your PLAB one, you just need to and create your IMC account, upload these documents, get them verified, get a date for press 3. It can be shorter. Okay.
Mm, okay.
Yeah, so that's
Okay.
basically how it is. Yeah.
Yeah, Eddie, thank you so much. This
Yep.
is very practicable, and you've actually brought out the realistic aspects of
Mm-hmm.
registering and then
Mm-hmm.
getting everything together. Because, sometimes
Yeah.
when you just go on the website, there's lots of information. You don't really
There
know
is.
where to start
There is.
from and all that.
Mm-hmm.
But I found this
Mm.
chat very, very valuable because you've even given advice on what people should start getting together if they're
Mm.
considering relocating to
Yeah.
Ireland.
Yeah.
And this is very, very useful. Moving on
Yeah.
to the section about exams.
Mm.
So talking about press one, press two, press
Mm.
three, and the PLAB,
Mm.
first of all, can I ask, what are the resources that people have found useful? Can you give any advice based on
Now,
maybe your experience and
yeah.
what you've heard? Yeah.
Yeah. Yeah. So now, in terms of resources, for press 3, resources are not readily available. That's one thing about Ireland. That's another thing about Ireland. In fact, for exams such as MROCP,
Mm-hmm.
okay, um, these are not resources are not readily available. We use MROCP UK resources for MROCP Ireland.
Oh,
You
I see.
understand? Yeah, yeah, they're not readily available. However, what we did when I was writing my own press 3, what we did, a couple of us from Nigeria, what we did is that we created a WhatsApp group. It was about 8 or 9 of us, or 9 of us. We actually had 100% pass from that group because of how we shared material, how we prepared, how we did everything together. So we created that WhatsApp group and we shared materials. So because materials are not readily available, what we did was that there was a tutorial class that we registered for. The guy's name is Mohammed, Mr. Plab, called Mr. Plab. Okay, that's the name of the tutorial, and we did that for maybe it's just 2 sessions. I think Saturday and Sunday sessions. He just comes, he gives you a rundown of how the exams will be, and then you go through questions. We did mock tests or mock exams,
Okay,
just so that will reflect what we're going to experience or what we might come across in the real exam. But what I would say is this: if you have lab materials, okay, if you have lab 2 materials, you can definitely use that for preparation for press 3 because it's the same pattern, okay? It's the same, contest. It's OSCE based exam, okay? So you're going to
mm,
have, the whole moving around the station, the same questions, general medicine, you're going to have pediatrics, neurology, you know, and the rest, counseling, psychiatry. Okay. So
okay,
if you want to start, you can start with materials from PLAB. However, you can join some WhatsApp group. Okay, there's a group in Ireland called what's the name? It's called, the abbreviation is Andy. Nigerian doctors in Ireland. Okay. So it's a WhatsApp group where you can join, and then you know, you can meet other people who are already in the group. They'll share materials. Now the WhatsApp group that we created in our time is still very much active. People are still coming,
great.
new people are coming into the WhatsApp group, and they usually do sessions in the evening. I think the abbreviation is Andy. Nigerian doctors in Ireland. Okay. So this is it's a WhatsApp group where you can join, and then you know, you can meet other people who are already in the group. They'll share materials. Now, the WhatsApp group that we created in our time is still very much active. People are still coming,
Great.
new people are coming into the WhatsApp group, and they usually do sessions in the evening. I think up to 3 times in a week via Google Meets. There, they also share materials. Okay. So in terms of materials, even though it's not common to find it, but once you're able to network with people, you can
Mm,
get some of these materials, but you can't find it online, you can't find it readily available out there. So you have to meet somebody who has these materials and they can share with you. So networking will give you the opportunity to meet people who have these materials and they can share it on WhatsApp
okay.
groups.
Okay.
Okay.
Thanks for sharing
Yeah.
these nuggets. These are things
Yeah.
not everyone would tell you.
Mm-hmm.
And I really appreciate you sharing all of this.
Mm-hmm.
For me, my personal mantra is when you're going to do something, you ask someone who's been there before.
Done it. So, yeah.
You
Yeah.
mentioned networking, and that
Mm.
is very, very key and very important. So, my
Mm-hmm.
viewers, as Dr. Eddie is here, he has an exciting package for any IMG who's looking to relocate to Ireland, particularly who wants a one-on-one session, because I believe we all have our own individual circumstances. So for that reason, he has a package where you can have a one-on-one chat with him, so he can actually look at your circumstances and offer advice tailored to you as an individual. And I'll be asking him for some of the links to his WhatsApp group for those interested, links to his personal consultation as well, and links to the website, the right websites where you can find information, for registration with the Irish Medical Council and
So
so
yeah.
on. Yes, I'll leave him to
Mm-hmm.
just tell us a bit about what he intends to do in terms of this package that he has, if there's any more he wants to add, because I believe this is something you should all consider if you want, because like he said, the information is not really out there. But once he has been through it, his study group achieved 100% pass. Honestly, what else more do you want? So please, Eddie, can you tell us a bit
Yeah.
more if I haven't, done justice
Yeah.
to it?
Yeah. Yeah. So actually, what I've actually started, so
Mm,
what I'm thinking, I plan to expand it. So basically, um, it's a tiered package. What that means is that some people just want advice. They want to know the basic information. They want to get basic information, and so in the first package, what you do is that you tell me the stage that you are, what you are looking to get. If you're looking to you just want to come into practice immediately, you want to come into training, you want to do training and all that, then, I will offer advices for you, give you a checklist that, you need to teach, to make sure that you are ready. Because one thing about Ireland is this, if you have everything that is required, you will get your spot. You will get it. Nobody's going to deny you anything. Okay, but
okay.
you have to have everything. You need to have your checklist. All the requirements needs to be met. Ireland does not compromise. If you miss one thing
Mm,
or the deadline is missed, nobody comes back for you. So provide the checklist. We provide advice on the best route. We give follow-up emails for the first package. For the second package, we're a bit more hands-on. We can help you with registration with Epic and verification of your documents. Can help you with creating your IMC account. It tells you the do's and don'ts in terms of creating your account, because some people create the account wrong, and that will delay them. It happened to
mm,
me. Okay. So if you create there are steps in creating your IMC account. Okay, if you miss a step, that will affect the remaining ones. And once it's wrong, causes delay. And if you try to contact IMC, there's usually, quite delay in them responding. You have to start the process all over
okay.
again. Okay. And, creating IMC account can be, quite tasking. So we help also with that. We help for those who are writing press three. We introduce them to people who are also writing. There are classes that they can join, you know, for tutorials, for simulations, examinations, history taking. You do everything online, and then with materials also. Okay. So those are these are just few of the packages. So there's another package we have that is called the add-on package. So there will help you look for once you already have, we'll follow you up through the process of your press three exam, and you pass the exam, and can help you if you're still in Nigeria. Most people will have to go back home after writing their press three exam. Okay, we can help you with sites to look for best jobs that you should likely get, best preferable areas that you should start with, how you should start, you know, and give you links, give you information on how to get referrals and all that. We help you with your CV and all that. So those are the packages that I offer at the moment.
That is very comprehensive, Eddie.
Yeah.
Yeah, even to the extent of helping people find jobs, because
Yeah.
in the UK, for instance, people have struggled to go through the PLAB exams
Mm,
and they've attended
mm,
academies, they've passed, they've got GMC
mhm,
registration, but at the
mhm.
end, struggling to find jobs. So
Yeah,
if you,
yeah,
yeah, it
yeah,
and
yeah. In
it's a
terms of
bit,
in
it's
terms
a
of
struggle,
jobs,
isn't it? Yeah.
Ireland takes experience, okay, or puts experience, give a priority to experience, okay. So if you have the experience and you don't have much gap in your CV, and like me that had more than 3.5 year gap in my CV, then finding a job usually is not difficult. It's not that
Wow.
difficult.
That's
Let
what
me
we
not
like to hear.
downplay it. Finding a job is not
Okay.
that difficult,
Mm,
okay? But your CV has to be very, very enticing. It has to be tailored.
mm,
You can't have a
hmm
CV that is everywhere. You can't have a CV that shows that you have little surgery experience, little medicine experience, little pediatric experience, little obstetric experience. It has to be tailored. If you want to do pediatrics, your CV should be comprehensive
hmm
and very enticing for pediatrics. If you want to do obstetrics, it should be very enticing for obstetrics. You have to tailor it and individualize it, and you must show your strengths in your CV. Okay, as with plenty other things, even if you are applying for, your specialist training, that's a different topic. There are a lot of things to also know in that
Okay.
area. Okay, but in terms of jobs, yeah, yeah, there are jobs here. In fact, Ireland does not feel their quota for employment for doctors. They're unable to fill it usually. So yeah,
That is good
I don't
news.
think
That
it's as
is good
bad as UK.
news.
Yeah.
Yeah, that is good news. And I'm happy to hear this. And I know my viewers are also excited to hear this. All those who sent loads and loads of emails, I have got
Mhm.
someone who has got all the information, and I would recommend that you consider his package. I would be dropping all the links that you need in the video description and in the comment section below. And if you still want to send in emails as well, I would be responding and would signpost you accordingly. So Dr. Eddie is so, so kind. Why do I say that? He has agreed to do a follow-up video, and the next part of our conversation, which I would urge you all to look forward to, is now going to narrow down towards the application process, an overview of it. He's going to talk about jobs, then also life as a doctor in Ireland. I'm sure lots of people are wondering how it is, particularly as an IMG, if
Yeah.
you're moving from Africa to an entirely different environment. Just an overview of how things have been for him so far, any challenges, and then benefits, the good things, salary. That is important, and so much more. So I would urge you to stay tuned. Don't miss our next video. If you haven't liked, please like, share, and subscribe to my channel. And I will see you in my next video. But just before we go, Dr. Eddie, can you just give us just a take-home message to any doctor out there watching today. What is one thing you would like to share with them, someone who's looking to relocate to Ireland?
Okay. Yeah, what I would say is relocating to Ireland is very doable and very possible.
Mm,
As long as you meet their requirement, and meeting their requirements is not difficult. However, you need to have patience. You have to be patient. Ireland is a country that will teach you patience. If they tell you they'll get
I
back to
like
you,
that.
yeah, yeah, yeah. If they tell you we'll get back to you, or hear from us in 8 weeks. If you
Mm-hmm.
like, you keep sending emails after 4 weeks or after 7 weeks. Nobody's going to, rush because of you. If they say 8 weeks, you better wait for 8 weeks. If they say 10 weeks, you better wait for 10 weeks because that's how it's going to be. Okay.
Okay.
However, if you meet their criteria, you can be rest assured that you will get it. And Ireland is a very good place to live and to work. Okay, I have to say because I've been to the UK and I'm living in Ireland. I never thought I was going to like Ireland like this. So I can tell you that Ireland is a good place. And the people that you are going to be working with, I've worked with a few good number of people, and everybody has been nice. Even the patients are quite nice.
Oh, good.
You really experience, you know, most of the things that we experience socially, like racism, abuse, and all that. You
I see.
really, so it's a very nice place to live and to work. Okay.
Okay.
Yeah.
Okay. Dr. Eddie will be telling us a lot more in our next video. Don't miss out on this because I'm really curious to hear. I've heard some things that sound so nice to my ears that,
Yeah.
racism is not like a big issue there and so much more.
Yeah.
So don't miss out,
Mm.
guys. I'll see you in my next video. Thank you very much. Thank you so much once
Yeah.
again, Dr. Eddie. It's been lovely
You're
having
welcome.
you,
You're welcome.
and I'll
Yeah,
see you
my
in my
pleasure.
next video. Thank you.
Thank you. Thank you. Have a
Bye.
nice one. Bye bye.